Hello, welcome to Texas Lone Wolf. Source for Red Pill Truth, nothing sugar-coated, alright? Today's topic is discussing chronic kidney disease, kidney health. This will be going on, it's going to be going on Friday. Friday's going to be kidney talk, alright? Now, it's going to be on Friday that we're going to see this educational material about chronic kidney disease. And now, I'm going to go ahead for the caveat, and I give credit to hospitals around the world, especially Pace Hospital in India. The Indian doctors know a lot about kidney disease, what is the main culprit of this. Now let's dive into this so we can know what to expect when you have kidney disease. And just want to give a heads up, I am a dialysis patient, and currently I have to do a kidney failure, ESRD. If you get declared that, only way you're going to get to feel better, you're going to have to anyway, we're going to have to take a good look at this. Sorry about that. I didn't mean for that to happen. Now I'm going to go ahead and redo this. Bear with me on this. I don't know why this is not behaving like I want it to. I'm going to have to delete this and put a new one up. So be patient with me. I'm going to go ahead and get the, I'm going to fix this. Let me fix this Windows capture. All right. Let me fix this. All right, just be patient with me. Let me fix this. Now, there's end stage. I'm gonna do an end stage renal disease because you need to know what to expect. Okay? Because this can happen to anyone. All right? This can happen to anybody. So I'm fixing to reload this. All right. I'm fixing to reload the page so I can get it to. I'm going to try to get this here to work. So let me figure this out. So I'm going to go ahead and do what I can to get this here to come up. There it is. That's what I was looking for. Now we're going to go ahead and look at this real close. Now, some of the symptoms of this renal stage renal failure or acute kidney injury is throwing up, feeling nausea, and I'm going to go ahead and say that I guess more females contract UTI. Anyways, I'm just going to go ahead and tell you this. The last stage is stage 5, end of chronic kidney disease, CKD, ESRD. It's called kidney failure, which develop when the treatment of kidney is either delayed or not treated at all. The GFR dropping below 5. Mine was at 8. They had to put me on dialysis. So, to learn more about this, I just want to say welcome to Kidney Talk Friday. Friday, the 22nd. Inability to filter waste products from the blood collected called kidney failure. So you eat red meat, it turns into creatine. All right? And when you eat stuff that's high in potassium, your kidneys can't get rid of it. The ESRD, last stage is stage 5. That's when you can't pee. All right? And this can build up a toxin fluid in the body, which can be life-threatening. So when you hit stage 5, your fluid restriction is severely limited. Usually 2 types of kidney failure: acute kidney failure, chronic kidney failure, 2 types. It's potentially irreversible. And prescription drugs and illness in the blood plus unhealthy habits will lead to ESRD or acute renal failure. So that's going to mean you're going to have to eat renal diet. They'll have to monitor how much you take in, and you have to get shots of insulin. So now we're going to discuss this. As some of y'all might know, I am a dialysis patient. You know, I went from 220 pounds down to 193.12 pounds in a period of about 3 months. This, I don't wish on nobody. I don't wish this on nobody. This can be fatal. So, if you are at stage 4, it's recommended you take your treatment seriously. And you know what the life expectancy is for stage 4 kidney failure or chronic kidney disease, ESRD? You're given a few weeks to live, then your body produces toxins inside the blood. You start bloating. And if your kidneys cannot get rid of the toxins and the trash in your blood, then your skin starts changing pale yellow. All right? Then your organs start shutting down. So CKD categorized in 5 stages based on kidney function. Stage 1 being mildest, stage 5 being the most severe. I'm at a stage 4. Anemia is associated with this. This right here is the last. Shortness of breath, mental confusion, nausea, vomiting. So loss of appetite, bleeding, itching, cold intolerance, weight gain, peripheral neuropathies, edema, changes in urine output, volume, and consistency. Foaming of the urine, indicator of proteinuria, abdominal distension. Folks, this is some serious mess. You know, it's been said if you live unhealthy and you eat junk food and all that, your kidney's going to have to filter that blood. Then you develop diabetes, so it turns your blood into acid. Then it starts eating at your organs. And your kidneys are there to filter the blood of all toxins, so to speak. So, yes, I experienced all of these. And I experienced these here. Is already something configured. It's really predicted CKD complication. Further drives advanced CKD kidney failure in a nephrogenic system fibrosis. Early symptoms of kidney failure include swelling, redness, pruritus, pain in the limbs, muscle weakness, difficulty lifting their legs as in climbing in the stairs or in a car, inflexibility of joints. You know, when I graduated from high school in 1992, I was able to wear my class ring. Okay? You follow me? Now, we're going to discuss this because this probably, some of y'all probably out there probably have affected on this. Marked decline in frequency of bedroom fun. Kidney failure symptoms in men also include ED, decreased libido, disturbance in menstruation and fertility are the prominent kidney failure symptoms of women. Women are not excluded from this. If you go to parties, you go to clubs and bars, drink alcohol, you're putting pressure on your kidneys. And it can cause cirrhosis of the liver. Now, you want to know how big the kidney is? It's about the size of a computer mouse. And everyone who was born from birth had a healthy kidney. And peer pressure, society, having fun in a worldly sense, promoting smoking, promoting drinking alcoholic beverages, eating junk food, Hot Pockets. Everything that's hard on your body is hard on your kidneys. All right? Now, anybody younger than the 60s have a higher risk of strokes and, many strokes, bone disease that makes you less anemic. You start losing RBCs, red blood cells. All right? Nobody's immune from this. Apart from above 2009 study can demonstrate there are more risk of factor ESRD such as smoking, engine exhaust, etc. Nocturia, urgency to urinate during sleep would also be one of the factors for ESRD. Nocturia could be due to undiagnosed diabetes. So we're doing a kidney talk. Diabetes makes you pee sugar out of your blood. And it's supposed to help you it's supposed to help you. See, if one organ goes, all the other goes too with it. And your life is in danger. Now, they measure your kidney failure risk by blood test. All right? Your blood test tells the nephrologist that what your GFR rate is. Okay? Anyways, so I need to let you know this. Decline in kidney function due to continued alteration of GFR in CKD, probably comorbid disease such as congestive heart failure, diabetes mellitus, etc. The chances of kidney failure increases. All right, the kidney failure risk equation, KFRE, is a prediction tool developed in 2011 for nephrologists to accurately stratify and anticipate kidney failure validation and proven numerous population. Nephrology team and hospital management utilize tools to resource salvage patients. Salvaging patients, yes. The cause of ESRD, only risk factor which progress to chronic damage can be specified reasons for kidney failure. Major cause of kidney failure resulting from progression factors accelerate chronic kidney damage as follows: proteinuria, hypertension, diabetes. Hypertension is high blood pressure. Diabetes, smoking. Okay, hyperlipidemia, high LDL, high LDL cholesterol that can help lead to a stroke. Obesity. I know. Society glamorizes obesity, saying, "Oh, this is normal." Society is full of malarkey. Proteinuria, increased level of protein in urine. That's when you're spilling protein. All right. Hypotension patients are 32 less likely to develop kidney failure than hypertensive. Controlling high blood pressure can reduce the progression of kidney failure. Diabetes, persistent increase in blood sugar levels. All right. If you're at 150, you're safe. If you go higher than that, so see, they go by A1, hemoglobin A1C. It's got to be under 6. Smoking from nicotine sources can initiate help in CKD progression, especially in diabetics, almost twofold. It can see with microalbuminuria development stage 5 CKD ESRD. All right, hyperlipidemia. That's a high lipid levels in blood. It's a predict incident CKD prevalent to hyperlipidemia appears to increase kidney function decline. Hyperlipidemia is a nephrotic syndrome, but like 80-90% of patients decrease kidney function. Proteinuria greater than 3G a day, elevated plasma total. And this is serious, folks. Now, let's take it up to the next level, shall we? Okay, let's take a good look at this. Cost of AKF, acute kidney failure. All right? Factors have to alter the blood flow to the kidneys. Factors could block flow of urine, damaging the kidneys. That has happened to me before. And let me tell you, I felt like I was urinating fire and had to constantly go to the bathroom. Factor altering renal flow could include liver failure, serious burns or dehydration, infection, heart failure, blood pressure medications. I told you earlier, RX prescription causes kidney damage, blood or fluid loss. Factor blocking the flow in the urine, kidney calcium, blood clots in the urinary tract, enlarged prostate, nerve damage in the bladder. Wow, that sounds serious. Bladder, cervical, colon, or prostate cancer. All right. Now, I'm going to go ahead and factors damaging including cholesterol deposit, blood clots, drug-induced renal disease. This is serious, folks. I can't pronounce that word right there, so. No one's immune from this. Did you get a notice of that? Now, children can sometimes suffer kidney failure as well. Children, a little child. Nobody's immune from kidney damage. No one's immune from it. Did you know that? Now, complications of kidney failure, ESR, or ESRD. A study in Israel in 1992 demonstrated infection and cardiac disease were primary cause of death in ESRD patients undergoing dialysis. So this is right here where it gets interesting. Before you throw a fit, if you're dating someone who is undergoing dialysis, loosen up on them. Give them some breathing room. Listen, if you want your boyfriend who's undergoing dialysis to live, or do you want him to perish? You want him to go take a dirt nap? Ask yourself that question. Now, ESRD can be linked to various clinical manifestation complications of kidney failure, which result in high morbidity and mortality and poor quality of life, progressive decline of kidney function, which interact with each other. Some ESRD complications are cardiovascular, neurological origin, can be quantified as follows. All right? Thickening of left ventricle wall in the heart, cardiac chamber dilation, enlarged heart chamber with difficulty in contraction. Wow. Ischemia is known as a heart attack or stroke, ischemia. Myocardial fibrosis, scarring of the cardiac muscle with increased collagen disposition. Heart failure is the inability of heart pumping enough blood for body's needs. Arrhythmia is irregular heartbeat. About 25-30% of ESRD patients with angina had no evidence of significant coronary artery disease, but under my number had silent coronary disease. Changes in brain white matter can disturb anatomical organization, confusion, and functionality, connectivity, etc. Cerebral atrophy, decrease in cerebral size, loss of neuron causes dementia, seizures, etc. Folks, pay attention to this. Osmotic demyelination syndrome leads to brain cell dysfunction. Now, complications of end-stage renal disease can be attributed, at least partly, to accumulation of uremic toxins. Did you know that? However, cause and effect of relationship between these compounds and the complication of kidney failure, uremia, has not been clearly established. Now let's go ahead and dig deeper into this acute kidney failure complications. Acute kidney failure complications include few or all the following: edema, fluid buildup. When your legs and your arms and everything swell. Chest pain is the pericardial region. Acidosis, acidic blood. I have that. Muscle weakness due to imbalanced electrolytes, and then taking a dirt nap. Now, kidney failure prevention. The prevention of kidney failure with avoiding or contracting AKI or CKD, nevertheless. Prevention of kidney failure can be initiated treatment strategy in the effect of slowing the progression of kidney failure to start early stages of CKD. Avoiding or managing diabetes, hypertension, and such health issues that cause kidney damage are primary step in preventing kidney failure. Maintaining a healthy weight and healthy food, exercise help both kidney failure patients as well as the high-risk population. Now, you may have to consider a diet to actually help you with this. Fresh fruits, whole grains, frozen or fresh vegetables, low fat-free dairy products. Some of you may not like this. Cutting back salts. 2,300 milligram salts a day. Sugars can help. Diet for ESRD includes choosing vegetables such as spinach, peppers, and broccoli. You got to do a cup of broccoli, but that's high in phosphorus. All right? Baking meat can be better than frying. When you fry, you put oil in there and it makes your kidney work harder. Foods without added fats or gravy can be okay? Shifting from whole milk to 2% milk. Well, I use fat-free milk and I've gotten along with it just great. Whole grain food, brown rice, whole wheat, oats, whole grain corn can be used instead of white rice. Wow, I didn't even know that. Reading food label can help, result in avoiding food in low saturated fats, trans fats. Food diary can track food and food habits. DASH diet plan can lower blood pressure. Salt will make you have high blood pressure. Other kidney failure prevention tips can include taking at least 30 minutes of rigorous physical activity daily, aiming for a healthy weight, getting enough sleep, at least 7 to 8 hours each night, abstaining from smoking and tobacco product consumption. That's going to make some people angry at this video. Stop your smoking and other tobacco product consumption. Limiting alcohol intake, thus avoiding weight gain. Exploring stress-reducing activity, sticking to one such as yoga, suiting your needs and help relaxation cope with emotional, physical health problems. I just read you this right here, and this is probably going to ring people, it's going to rub people the wrong way. Now, vitamin D level, albumin is protein, serum bicarbonate, hemoglobin, hemocrit, increased level of serum creatine. You get this from eating red meat, blood urea nitrogen, serum potassium, serum phosphorus. Your kidney's job is to filter those things out of there. Now, kidney failure treatment, it becomes inevitable. Nephrologists provide appropriate diabetes dialysis modality based on patient preference. Opt for vascular access for hemodialysis or peritoneal dialysis. ESRD treatment options may include medication, diet restriction, fluid management to treat acidosis, renal transplant, kidney transplant. You got to find somebody that's a match to you, which can take anywhere from 5 to 10 years if you're lucky. Now, I want you to know that acute kidney injury, AKI, is reversible. They give you fluids. Chronic kidney disease is irreversible. Illness, injury, or medication for AKI, CKD, diabetes, high blood pressure, and I can't read the rest of the words. Now, I have these, but CKD, fatigue, weakness, anemia, poor appetite. Okay? Changes in urination. You ever go and pee and your urine has a foul smell to it? That's CKD, my friend. So if your AKs can progress into CKD, I went into that. CKD progresses ESRD, require dialysis and a renal transplant. Now, hope that AKI taking dialysis may be used to until the kidney function recovers. Dialysis is a common replace treatment for kidney transplant, especially ERT stage for CKD. Now we're going to go ahead and do some facts, frequently asked questions. Now, what are creatinine levels for ESRD? Should be about 3 grams or less. All right? So, ESRD is stage renal disease. It's the 5th last stage. So I'm on 4, so to speak. Now, dialysis See, I'm on stage 4. Now, can we stop dialysis if creatinine is low? Nope. You can live for up to a week or 2, then your body starts shutting down. So we're fixing to go through all these facts. Usually home dialysis sessions are much shorter, spanning 2 or 3 hours, until they're much easier for a patient to tolerate. You see, they put this thing in you, and then you have to make all the fluid go to this area, and then you hook up to a machine that pumps all the fluid out of you, all the toxins and stuff. But I'd rather do hemodialysis clinic. That way they can clean your blood with a machine. Can kidneys repair without dialysis? No. Kidney failure patient needs to attend dialysis session. If dialysis sessions are not initiated, the patient may live for a few weeks or several months, depending on the health, remaining kidney function. It is not recommended to skip the sessions. Don't. While majority of kidney failure complications can be managed with medicine, only through dialysis or transplant can filter waste from blood, so to speak. There are various factors affecting the short and long-term survival of ESRD patients, such as cause of kidney failure, type of renal replacement therapy. See, when you get on that, you're going to have to take anti-rejection drugs to make sure your body doesn't reject that kidney. And comorbid disease, Iranian studies cause of 1 to 5 year, 10 year, 15 year survival ESRD who underwent hemodialysis was 83%, 25%, 3.8, and 1% respect. So yeah. So that Iranian study, it was about 83%, 25.2%, 33.8%. Yeah. Yes, kidney failure can be cured with a replacement therapy such as kidney transplant. No, end-stage renal disease not reversible by drugs. Nevertheless, there are renal replacement therapies which can help. All right. Best diagnosis of kidney failure could ultrasound, CT scan, diagnostic tests, or underwent if any blockage. Extreme case, kidney biopsy would be prescribed. Now, I'm telling you, this kidney talk is very important. And some bosses in workplaces don't understand this. They want to blame their employees for being, saying they don't listen, they don't do this, they don't do that, they don't do this. If you're being treated like crap on the job because of the symptoms of CKD, quit and don't look back. All right? So they got different names. So now this, I'm going to put this in the description box so you can read on this, okay? Now, no, prescription drugs can cause kidney damage. Doctors ain't going to tell you that, all right? I didn't want you to know doctors ain't going to tell you that. So anyways, I'm going to put these things here in the description box. So anyways, just now you got to be careful what you take nowadays. But remember, if you go do dials at home, you got to stay on top of everything. So look at this. So the GFR is what the doctors use to tell you. So it's pretty bad. Gout, anemia, high phosphorus, hyperphosphatemia, high potassium, pruritus, itchy skin. I had that. Metabolic acidosis, and heart disease. All that comes with this. So metabolic acidosis is build up acid in your blood. So when it goes high, the hospital will take you right in, take it to IR, put that catheter in you, then you go and do dialysis. I'm telling you, this is very serious. Now, I'm going to put all these links for you to see. Adults with CKD are at higher risk of taking a dirt nap earlier than adults of similar age without CKD. Now, if some of you have high blood sugar levels, get that taken care of immediately, or you're going to suffer the same fate as I am. Okay, health problems due to low kidney function. Loss of appetite or nausea, decreased bedroom fun response, confusion with memory, thinking, or depression. Low calcium, high phosphorus level, high potassium level in the blood, cause the abnormal heartbeat, can lead to death. Yes. Anemia or low red blood cell count, which cause fatigue and weakness. Yep. So I'm going to put this in here and let you see this. I want to inform everyone. I need to inform everyone that no one's out of the woods. And a lot of people take their kidneys for granted. So I don't know if I want to watch this on YouTube because I don't want YouTube to flag me down with this problem. So I'm just scroll down here. You got nausea, vomiting, loss of appetite, fatigue, and weakness. Sleep problem, urinate more or less, decreased mental sharpness, muscle cramp, swelling of feet and ankles, dry, itchy skin, hypertension, difficult to control, shortness of breath, fluid builds up in your lungs. Chest pains fluid builds up around the lining of the heart. Very scary, huh? You got to be careful what you put in your body. In North America, it's the most dangerous place to live. Everybody's in bed with each other and polluting the food chain that we all enjoy and eat. All right? So this is a healthy kidney. Look at this. Then this one here looks like really, 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 really bad. These are right here fluid filled sacs or cysts. And I'm going to put all this. I'm going to put all this. Note, see, this here doesn't matter. This doesn't matter. Anybody from any bloodline can come down with CKD. This right here, you're not being black, Native American, or Asian American. Let me tell you this. That's labeling a certain group of people right there. Anybody, anywhere can come down with CKD. Anyone can come down with this. I seen a Muslim in a dialysis clinic. I've seen young kids, young as 20, in a dialysis clinic. Anybody can come down with this. So, I'm just letting you know that this is serious mess. Okay? I'm just going to let you know this is serious. A lot of people don't realize that the way you diet, the way you eat, the way you do things every day, your kidney's going to take a toll. Now, I'm going to go ahead and I'm going to put this in here, and now you have to go to dialysis to keep yourself in check. But even though when you go into dialysis, you're putting your life in somebody else's hands. So I'm on stage 4 of CKD. And that, my friend, when the doctor told me to eat more red meat so I can keep going to dialysis, get that creatine out of my blood. But that ain't no problem. As long as I go to those treatments, I can just keep on going. And it's very important that I do this. But if your kidneys are functioning, take care of them and they'll take care of you. Now, I'm I'm going to put these links in the description below. Take care of your kidneys and they'll take care of you. All right, I'm out. And also, one more and last thing. Don't forget to click subscribe and comment below. Okay? Thank you for watching, and you have a great day. Peace.